Good evening. A very warm welcome to those attending the Families, Health and Wellbeing Select Committee this evening and to our viewers watching live on the Council's YouTube channel, Hillingdon, London. I am Councillor Philip Corthorne and I am Chairman of this meeting. Details of the business to be considered today are shown on the agenda, copies of which are accessible online under the live broadcast. For those present in the room and intending to speak, please note that you will be filmed and any statements you make will be recorded and made public. A reminder to anyone speaking today that your voice will only be audible online if the microphone is switched on. We are not expecting a fire drill, so if the alarm goes off, please follow officers to the fire exits and out of the building to the designated meeting points. For those in the room, please switch off any mobile devices before the meeting starts or put them on silent. Please note that councillors on the committee may use their laptops or tablets during the meeting to view the agenda paperwork. And so, before we move on to the agenda, I'd like to introduce the councillors and officers present. We have Councillor Hina Mkwana, Vice Chairman of the committee, Councillor Judith Cooper, Councillor Steve Tuckwell, Councillor Kerry Prince, who's the Labour Opposition Lead, Councillor Colleen Sullivan, and Councillors Jan Sweeting. We also have Mr. Tony Little, who is the Roman Catholic representative. And to support our discussions this evening, we have the following officers with us, and I'll introduce them too. Dan Kennedy, Corporate Director, Central Services. Kelly O'Neill, Director of Public Health. Jane Mumford, Head of SEND. Tia Sohi, SEND Team Manager. Rani Duddy, Education Manager. Sarah Phillips, School Place Planning Project Manager. Catherine Angelini, Virtual School Head. And last but by no means least, Anisha Teji, Democratic Services Officer. And with that, I will move on to the main agenda and will ask for apologies for absence, please.
Thank you, Chairman. Apologies for absence from Councillor Haggart with Councillor Sullivan substituting, and apologies also from Councillor Rodriguez with Councillor Tuckwell substituted.
Thank you very much, and thank you to those councillors for substituting this evening. Declarations of interest in matters coming before this meeting. Are there any? There are none indicated? No, so we shall move on from that. Okay. And then to receive and agree the minutes of the last meeting. So I'll move the minutes of our meeting held on the 2nd of February, and in doing so, there are a couple of things that I would like to say. In respect to the reports on early years and children's centres and youth services, Councillor Prince and I have put forward the information that we would like to see in the reports, which are in the process of being scheduled in the work programme. I've also put forward what we want to see in future reporting generally in terms of performance information, trends, impact and so on, and I've enlisted the support of the Corporate Services Select Committee Chairman, Councillor Richard Mills, and Leader of the Council, Ian Edwards. You'll recall that a report went to Cabinet since our last meeting with recommendations from Corporate Select Committee for the introduction of a regime of standards reporting and performance reporting to that committee. So I very much welcome that, and I think that's part of what we're looking at moving forward. And those recommendations have been accepted by Cabinet. So in moving the recommendations, I will just make those comments. Councillor Prince, do you want to comment?
Rushing of microphones. Thank you. Yeah, I just wanted to say how disappointed we are that we didn't get the youth services report at this meeting, as we agreed some things we wanted to see quite some time ago. And I wonder whether we can request that we have it for the April meeting, as it is this committee that requested it, and after May this committee will change. So it would be nice to have that when it is still this committee. Thank you.
I have some sympathy with what you're saying. I think you've been around long enough as I have to know that we can't get things exactly when we want them for all manner of reasons. I know Anisha is diligently pursuing this matter now, and she will report back. So the request is noted, and I don't disagree with what you're asking, but we will do what we can. Thank you very much. With that, are the minutes of the last meeting agreed? Is it a point of accuracy, Councillor Sweeting?
No, it's following on from what my colleague was saying. I mean, in essence, what is important, I think, is we just have something quite simple, which are the youth centres, the audit of the youth centres, the hours of operation, and the number of youngsters that are using our youth centres. Quite a simple piece of information, I would have thought.
Indeed. Let's see what we can do. We will report back. Thank you. With that, can we agree the minutes of the last meeting? Thank you. Thank you very much. Right, so we come to our first report of the evening, which is a verbal update on COVID. We had, you may recall, a request from committee a while ago for an update on where we are with this. And I'm happy to say that with us this evening is Kelly O'Neill, our newly appointed Director of Public Health. I should say interim, I think, to be more precise, shouldn't I? Very good to meet you. Sorry we didn't have a chance to chat before this, but pleased to meet you. You're going to present to us on the current position as it is, and I believe there's some information to follow. So I'll hand over to you. Thank you, Kelly.
Thank you, Councillor, and good evening, committee. Nice to meet you all. I feel slightly embarrassed because actually the chair of the lead corporate director, Dan, is over there, and he's actually sort of has led this the borough through the last 2 years. So I'm vicariously giving out information, but that belongs to you. So thank you very much, committee. So the focus of my update will be on a number of different areas this evening. The current position of COVID-19 in the borough, the start of the analysis of the work that's looking at the impact of COVID on different communities in the borough, and most importantly, the legacy of this work, what we've done and what we've achieved, and how our learning over the last 2 years will inform the way that we work more effectively with residents, particularly in a more systematic way of tackling health inequalities across the borough. So the borough response, as you will be aware, has been led by a sort of partnership multi-agency health protection board and supported by a COVID-19 operational group that meets the framework of the Civil Contingencies Act and the responsibilities therein. This partnership approach has been highly effective and has brought together the Hillingdon Health and Care Partnership partners to support the strategic objective, which was national, to protect lives and protect the workings of the NHS and social care. And actually, as someone who's come in quite late, that's been highly effective as part of a sort of a matrix working across the borough. So over the last 2 years, through the Health Protection Board, the council and partners have supported residents who've been isolating, have set up testing and contact tracing services, and have really effectively rolled out the vaccination programme, and importantly supported outbreak management, particularly amongst vulnerable settings, notably amongst care settings and schools. In terms of the national infrastructure, Hillingdon has absolutely been the national leader on the support of arrivals into the UK and the infrastructure that has been the managed quarantine service. And as the substantive Director of Public Health in Hounslow, that has been a massive task for Hillingdon. In addition to that, I cannot emphasise that the borough partners have managed to maintain health and care services for non-COVID activity. So this has all been going on concurrently. You will be aware of that. So we're at a very strange point in terms of our pandemic response. Our current COVID data is slightly inaccurate because of the changes to testing behaviours that's happening across the borough. And as you will be aware from the media, the access to free testing changes as of today. And that accuracy of the picture is going to be even more difficult to obtain as we move forward. So the current rate of infection is 598 per 100,000 population. Doing a rate allows us to compare across different population sizes, so that's incredibly important. But for Hillingdon, that means 1,847 new COVID cases in the last 7 days. And as I said, this is a minimum accurate picture. The real picture is likely to be considerably higher than that. In terms of that position in London, Hillingdon has the 25th out of 32 boroughs highest rate. We don't count the City of London because it's a slight anomaly statistically. And this rate and this inaccuracy has been developed over the last 8 weeks, particularly the changes to restrictions nationally and the lifting thereof. In terms of testing, what we have started to see, and this is very different, is that the rates are highest amongst more affluent communities in the borough, where testing has been consistently high throughout. And what we are seeing in looking across London is actually the rates show considerable variation to the more affluent boroughs in London recording really high rates. So in the current highest is Kingston at 428 per 100,000, down to Barking and Dagenham, which is 428 per 1,000. So quite a difference in rates. In terms of what we know is really important, so really accurate data, much of the data that we're going to be looking forward to in the future is predicated on absolute numbers. So who's going into our hospitals, what the number, where testing is occurring, particularly in health and social care, who's testing positive. And important to notice that these are our at-risk communities, and therefore really focusing on them is going to be incredibly important, not least for the operational delivery of health and social care. And COVID numbers that are high in all of those areas really impact on challenges in terms of moving people through that health and social care pathway. So the current data is 74 COVID positive inpatients at Hillingdon Hospital, and in terms of our care settings, we've got 9 outbreaks, and across all of those 9 care homes, there are 36 residents and 8 staff who are positive. So we maintain an overall oversight and case management of each of those settings. And the message is really clear. In spite of what we're seeing outside, COVID is still very prevalent, community transmission rates are still very high, and it is still a real challenge dealing with the infrastructure and the operations of hospitals, particularly because the infection prevention and control procedures have to reflect those numbers. In terms of the impact on COVID across the borough, so as we've moved into this next phase, it's a really opportunity to deep dive into the information, to really understand what's been our learning as we've systematically gone through the last 2 years, and then think about what does that data tell us in terms of what our services need to do across Hillingdon Health and Care Partnership. So overall, 96,301 people in the borough have tested positive, and more recent data has been able to demonstrate that of that, 8,780 have had more than one case recorded, so reinfection rate. That's not entirely accurate because that's quite new data. It's quite interesting to see where that data has occurred, and there are a very small number of people that have recorded a third case of COVID. And we're able to understand who those people are that have tested positive, what their gender is. It tends to be more women than men. Women test more than men. And we know what age group they are. And we also know their ethnicity, where it's recorded, and the ward that they live in. So you can start looking at areas of the borough where there has been what we call enduring transmission. So this is continual transmission across different communities. And where those communities are less risky, that's an expected outcome. However, when you start seeing under-vaccinated communities within those enduring transmission areas, this is where that burden of risk really needs to be targeted in terms of some of the work that we do. When we look at those kind of enduring transmission areas, can't really escape the risk profile of those areas, which they will be the more deprived areas, and they are. They're more densely populated, more people live in overcrowded conditions, so where isolation is difficult and challenging, so therefore you see an ongoing spread across households, and in workplaces, so where people congregate together, we see that ongoing infection transmission, and we've seen it in schools, we've seen it in care homes, and we see it in some businesses. So when we also look at the data, we can start to see the impact of some of the work that we've done in terms of hospitalisations. So if you look back over the first wave, when there was massive numbers of hospitalisations, particularly affecting our older communities and those with pre-existing long-term conditions, and the really poor outcome for some of those people. So that's where the the highest percentage or highest number of people who died as a result of COVID was demonstrated. And as we move through those various waves and start to roll out the vaccination program, we start to see, whilst the rates were higher in subsequent waves, the hospitalization level and the number of people that died was considerably lower. So the vaccination program has delivered what it should have delivered, which is protecting our most vulnerable people, albeit that we have to still maintain that ongoing booster next vaccination to maintain antibody levels amongst that really high risk community. But what we are seeing now is where there are those 74 people in hospital, and that's sort of an average sort of day inpatient number. These are people who are in because, well, they're in with COVID rather than because of it. So again, this gives us a picture that community transmission is incredibly high. In terms of the number of people that have died, we've recorded that in two ways over the last 2 years. Initially, it was the number of people with certified deaths within 60 days. That's 848 people, a rate of 274 per 100,000. And within 28 days, which was the newest statistic, 723 people, that's 234 per 100,000. Hillingdon is roughly about 10th in London, and it kind of is congregated around northwest London. So northwest London has as a region has had consistently higher rates of hospitalisations and deaths, probably due to geographically its location near the airport. The issue with northwest London, it's a very well connected travel hub, and that's great in times when there isn't a pandemic, but not quite so great when you've got a virus spreading. We also can tell what the pre-existing long-term conditions are and where there is higher risk of those conditions amongst people who have died. So in terms of that Hillingdon Health and Care Partnership work, targeting that rising risk group and preventing long-term conditions is an area that's going to be picked up as part of the change in scope of the Health Protection Board. In terms of vaccination, really, really positive, to be congratulated. 7th highest in London, and remember vaccination is much, much higher amongst more affluent communities. First dose 75%, second dose 70%, booster dose 50%. Again, 7th highest in London is quite an achievement, and that work is still ongoing because there's still quite a considerable number who are yet to be vaccinated, and the data tells us what that number looks like. So there are 74,869 people who have yet to have a first vaccination, of which 5,446 are over the age of 60. Now we know where those people are. We know which communities they live in, and actually the work that we're doing in terms of the vaccine COVID champions, the work with the bus, and the street-by-street, community-by-community engagement work that Dan and Kevin are leading is really effectively taking that conversation, building trust, building confidence and addressing vaccine hesitancy. But really importantly is the nature of those conversations are, whilst incredibly resource intensive, are a real investment to save, because it's not just about vaccine hesitancy, it's about all those wider services that same group is not accessing. So in terms of next steps then, so the Health Protection Board, which has, as I say, has been a really effective matrix working across the system, has now reset its terms of reference to not solely focus on COVID, although it will maintain its ability to respond to an increased risk, a new variant of concern, all those other things that we've been effectively responding to, but it will also tackle all of those wider health protection areas, particularly using the kind of the infrastructure that's coming out from northwest London, this new population health management approach, which really is a systematic way of tackling inequalities within our boroughs. So really targeting those people at greatest risk, and those people that have been at greatest risk for generations. We know who those communities are, but doing it in a way that effectively engages with those people and bringing the work of the health protection, the health and wellbeing strategy to gain better access to, experience of, and benefit from health services. So in terms of our COVID response, we'll maintain that ability to respond, albeit that the data we'll have will be less accurate, but actually in terms of those vulnerable settings, we've still got that data, we've still got access to it, and we'll work as a partnership to address that. And fundamentally, the learning from the last 2 years has now got to be applied to that health inequalities agenda and much wider. And I think there is absolute commitment through Hillingdon Health and Care Partnership and through the partners on the Health Protection Board to tackle that. Thank you.
Thank you very much indeed. Thank you, Bond. Thank you very much indeed for that, Kelly. Before we open up for questions, just one quick thing. You referenced, I think, perhaps outside the meeting, to information that we are going to receive in relation to this. Could you just explain what that is, just before we open up for questions?
Yes. So the data that comes nationally, and it takes a little bit of. I've learned how to do it recently, so I won't pretend that I've learned how to do it across the whole of the pandemic. But the data is quite considerable. So actually, what I've put together is a report that sets out all the dashboards and the data statistics that we've been using, and I've put a kind of an easy read. I hope it's an easy read narrative, so that it doesn't sound like public health people trying to be clever, but actually putting it into a way that people understand, because I don't really like medical statistics. So what I've put that together, but I can't give it to you today because I made a silly mistake in terms of I made the data yesterday's data, so therefore it's not allowed to be used until possibly tomorrow. Okay, so that data lag, it's a sort of a data sensitivity issue with UK HSA. So I will circulate that tomorrow. Might tweak this a little bit as a result of this evening, but you can see, and any questions, please just come back to me.
Thanks for that explanation. It's good to see, since public health came back to local government, back in 2013, it's good to see how it's been shaped, I think, perhaps in a more user-friendly way, I guess. It's good to see examples of that kind of work, so thank you. Okay, what questions have we got? No one's indicating yet, so I'll bring in Councillor Tuckwell, please.
Okay, thank you, Mr. Chairman. I've just got a question, but first thing, thanks for the update, really useful. I think we've all been affected by this situation, so it's good to hear what's happening. My question relates to the 74,000 people that haven't been vaccinated, and it's good to hear the work that you're doing, or that's being done in terms of community engagement and getting people on. What I'd really like to understand is, what's the trajectory of that? I mean, is it an improving trend, and sort of by how much, and what do we expect it to sort of go down to, hopefully in the not too distant future?
Well, the ongoing offer, the evergreen offer, which the NHS is labelling it, will be ongoing, will be of long duration. I have to say, there are, for want of a better phrase, there are no low-hanging fruit here. Every single person that's vaccinated is a hard slog. So changes in government policy may help this trajectory, because at the moment it's the vaccine bus. On one day it did 60, and I have to say I nearly fell off my chair. And that is wonderful. So people's motivation and what incentivises them to get vaccinated now is very different to what it was before. And so when we start seeing tourism pick up and people wanting to travel, that's what will motivate some people to get vaccinated. Other people, I'm not sure that we will ever be able to get them vaccinated. And that, I hope, is based, so their protection level, I hope, will then be based on having minor infection and developing sort of acquired antibodies, which won't protect them well. And unfortunately, we will still have a small number of deaths per week that will be within that 28-day period of COVID. Now, it won't necessarily be because of COVID, but it may be that COVID has exacerbated a long-term condition and they are not vaccinated. And it's difficult to really understand truly, was it COVID, but it is what it is. I think by the end of the year we will get this figure down, but as I say, it'll be a hard slog, and I wouldn't want to put money on what that number is likely to be. I think it depends what government policy is able to motivate people towards doing.
Thank you.
You're welcome.
I've got Mr. Little.
Thank you. The disease spreads where you get gatherings of people together. Schools are a prime example of that.
Yes.
What sort of continuing work will be done with schools to minimise infections, given that the general tenor of publicity in the community is it's all over?
Yes, I think schools are one of those areas, and particularly as staff and head teachers are very aware that it's not over, and they've had one hell of a time over the last 2 years, and have seen the absolute, the considerable loss to learning of young people, and that will have a legacy for a long period of time. So the DfE publish a contingency framework, which they regularly update, which sets out green, amber and red actions. What we tend to do is when schools get a number of cases reported, most of them they're pretty much experts on what measures to put in place, some of which are effective, some of which are less effective. But when they need some help, they reach out and they call us in public health. We then talk them through what measures can be put in place and what measures may be effective. But certainly increasing the vaccination, particularly of adults within schools, is a highly effective way of protecting that group. And head teachers, as employers, have a responsibility for health and safety. That has weighed heavily on head teachers. And in terms of young people, the percentage of young people who have been vaccinated, roughly about, for those who've been eligible, is roughly about 52%. To be honest, most of those children will have disease-acquired antibodies by now. I can't really tell you in any great details of when this impact's going to be over. I think as we see new variants, there'll be continuing outbreaks within schools. I think they are, as I say, schools are fundamentally more able to deal with them because they have become incredibly experienced at it. But the support is there should they require it. Oh, sorry, that was a long-winded answer to your question. Apologies.
Very, very informative one, though. Thank you very much. Councillor Scrutiny.
Well, can I thank you very much for that very informative and enthusiastic rendition of what's been going on. The concern I've got are those 74,000 that are not vaccinating. Have you been able to contact some community leaders that might be able to sort of help to sort of get to their own communities to encourage them to be vaccinated? How has that worked?
Yeah, so essentially, so Dan and his team have actually, they are the community and faith leaders have been quite robust. This predates me, so I don't want to steal some thunder here.
So, thank you, Kelly. So our sort of community engagement teams have been working regularly, in fact, throughout the pandemic, with faith and community leaders, of which we're reaching out regularly to 50 through Fiona Gibbs, and so we had various virtual seminars, information sharing, and what was really helpful was that we were able to dispel any concerns or misunderstandings. We were able to provide information about infection control, and importantly that provided the link into the communities about what some of the barriers or the concerns, and where we may have needed simply just to provide more information, which will enable members of the community to access vaccination or further information and advice if they needed it. And that included, for example, members of Kelly's team who were there from the public health team. It included, it did include GPs and other sort of medically qualified experts, which was very informative and allowed a sort of free-flowing question and answer session as well. And that's something that's continuing now, and it hasn't stopped, and we're continuing to answer questions and provide information to community leaders and faith leaders.
Okay, right. Okay, no one else indicating. I've got a couple of questions. Sorry, were you indicating? Okay, I've got a couple of questions. I'm interested really in sort of life post-COVID. We debated about a year ago now what we should take as a major review. There was an idea that we should perhaps do COVID and what's the future going to look like, and we didn't in the end because we thought, we're not out of the woods yet, and clearly we're still not out of the woods. And I think whatever happens in the future, things aren't going to be the same. And I'm just interested in our view of how things are starting to take shape in terms of what might be different moving forward in terms of ways of working. And I'm thinking of care homes, sheltered housing schemes, carers gaining access, all the rest of it, all the human contact that comes into play in that sort of situation. There are all kinds of risks and challenges among older people, for example. in the context of a situation where restrictions have been relaxed. I'm just wondering how you see that whole thing coming together, in a sense, to the extent you can answer that question. And the other thing I would just like to ask as well, and I'm very pleased by the way to see we're going to use a legacy of this episode to try and strengthen our work on tackling health inequalities. But I'm interested in what's come out of this episode in terms of making health partners work better, more effectively, more efficiently. We've got the ICP. We talked about it in my Health and Wellbeing Board days. We know there are organisational challenges where interests don't necessarily coincide, but actually there's a greater good to be served, isn't there? So I just wonder what your take is on that and what we can take from this episode that can perhaps give us some encouragement for the future in that regard. Thank you.
Yeah, sure. In terms of the vulnerability, so the national direction of travel is living with COVID and the various reports. I think to add to that, it should be living safely with COVID. And there are some difficulties that we do have in terms of testing numbers. The national funding of some of the COVID response measures won't be in place. And I think there was a conversation with the sort of Department of Health the other day, which started talking about actually for the future, if we are going to continue this level of funding for COVID, something else has got to stop. So there must be some economic implications and some sensibility that goes with it, because we cannot maintain this current response level. However, we have an infrastructure here through regular COVID vaccinations until there becomes a time when it probably morphs into what flu has become, because in many respects, flu kills 17,000 people every year. Cardiovascular disease across the country kills. The national lead for cardiovascular disease said in 1 year, cardiovascular disease was COVID without the vowels. It kills exactly the same number of people, but it does it every year. And this was the Department of Health. So in terms of the toolbox that we have, the most vulnerable communities are those that are most protected. So maintaining testing within care homes on a regular basis of staff and of residents, and high vaccination levels, and really robust infection prevention and control measures has been a pretty effective way of supporting some of those vulnerable communities. But that level of response in those vulnerable settings has to be maintained. So as new people move into care homes, getting them vaccinated and supporting families to make that decision where those families make those decisions is absolutely going to be key. In terms of COVID numbers, I think what we'll see is some seasonal variation. We'll see, the more winter months being more adversely impacted. So winter pressures in the NHS and in social care are probably going to be exacerbated for the next few years, because COVID is going to be with us, probably at least in its current and sort of dwindling format for the next 5 years, give or take a new variant, because it goes back to what the Chief Medical Officer says. Unless we're all protected, none of us are protected. So variants will emerge, because that's the way viruses work. They morph, they're chameleons of the microorganism work, they'll adapt to the environment they live in, and their main reason to exist is to infect people and do damage. That's what viruses do. So actually, policy on globalization of vaccinations and uptake across the world is absolutely key. Having an infrastructure that can identify these variants of concern is going to be key, but not just in the UK. It's got to be part of international policy, because things like the South African identifying a variant is because South Africa are good at tracing variants, not something that we should dispel as it's a South African problem. We need to contribute to that. In terms of the impact here, we've got to manage this as well as all the other things, because while we've managed COVID, we've had to drop other things. So things like cancer screening uptake is on our list of priorities for the Health Protection Board. We've got to get that up to a higher level. We've got to get people back into screening. We've got to get other vaccinations sorted. We've got to get people having blood pressures. All those kind of things that contribute to long-term conditions, so that we generate healthier communities, so that when we look at risk, it's risk not just of COVID, because actually for a healthy person, COVID poses limited risk, although some people without long-term conditions have had a very poor outcome. So we need to make a healthier population, because viruses don't create the impact on somebody's health when somebody is healthier. So I think in terms of that, it's part of the much bigger picture. But as a Director of Public Health, I would really advocate that what we have done in the last 2 years is be able to demonstrate what your second point, Chair, is demonstrate that by working together effectively, and I'm not saying it didn't happen before, it did happen before, but actually what it's demonstrated, it's accelerated the ability of partnerships across ICPs to really understand, to have a joint mission, and this has been the mission, and actually through it, it's probably accelerated the progress of the ICP at pace that probably would have achieved between 5 years within sort of a year, 18 months. So I can't emphasise how good your partnership is, and my substantive job is over the borough, and actually the way that your team have operated in this kind of matrix way slightly embarrasses me elsewhere. We're not taping this, are we? Slightly embarrasses me elsewhere because it has not been that as effective as it has been here. I don't know whether you want to add anything, Dan, from your experience.
I mean, matrix in a number of different ways, really. I suppose the first is that it's allowed us to be very agile by working with a range of different service leads across the council. So there really has been a really strong one council commitment to it, and it's meant that we've been able to operate very quickly rather than, channel everything through one team. I think the other thing that's been very important as well to me is actually how strong the very local partnership working has been with health colleagues and voluntary sector as well. And so the Health Protection Board, which has met every single month since July 20 and continues to meet, has involved Hillingdon Health Watch, for example, representatives from the hospital, health and care partners, as well as CCG, and clinical commissioning group, and representatives from GP Confederation, as well as the chairman, who is a GP. So that it's been really strong. We've had good information exchange, and I just think the partnership working is actually a really important legacy and continues, and it will actually help us to address and catch up on some of those key health improvement outcomes that Kelly's mentioned. So I think, in summary, it's really strengthened us, and it's a really positive that we can take forward.
Thank you very much indeed, Dan and Kelly, for that. No one else is indicating, so I'll wrap up this discussion with everyone's agreement. I would like to say that it's good to hear what you've said, Kelly, coming in as a fresh pair of eyes, making the observations you've made about our care partnership in the borough. Of course, we're regional now from a CCG perspective. We're no longer Hillingdon focused, but I think one of our concerns was how will it work on a regional basis. It's really encouraging to hear what you're saying there. So thank you very much for that. Good that we're really trying to build a legacy out of what's happened that had a wider application for the wider world of health and all the things we're trying to achieve. So really good to hear that. No one else is indicating, so I think we'll wrap that up. Is everyone happy? Can we move on? Thank you very much. Kelly, thank you very much. Feel free to say, but don't feel you have to. Thanks very much. Okay, so our next agenda item 6, Standards and Quality of Education in Hillingdon, which is a report which previously was reported to the former RESPOC. So some of you may remember that in a previous life. It will be introduced to us today by Dan and supported by the officers who are with it, so that'll be good. Then we'll have an opportunity to ask questions. The second recommendation before us invites us to submit comments for when this is considered by Cabinet in April. So I will float some ideas. They're no more than ideas in draft form. Let's see how they go down, and we'll see where we go next on that. But for now, let's have the introduction, please, Dan, if you would. Thank you very much.
Thank you, Chairman. So, agenda item 6 is the annual standards and quality report for education services for review and comment by the committee. We have joining me today colleagues from service leads from across education services who will in turn highlight some key points for the committee from the report. Before I hand over, I would like to highlight one particularly important development over the last year, which has involved working closely with school leaders and governors to progress our local education partnership, which will provide the platform for further improvements to education outcomes, which includes some of the disparity points that Kelly, the previous item, highlighted, which exist in our communities in terms of educational outcomes. So without further ado, though, I'll ask Rani to kick us off, and then I'll hand over to Catherine, and then Jane and Tia before we take questions. Thank you.
Thank you, Dan. Good evening, committee members. I hope you had a chance to read the report. I know that it's a very large report, and the previous POC committee, REASE-POC, mentioned that if we could try and redesign it in a different way. So what we've done with this report is put it into 3 key sections. So I hope that's helped with the readability of the report. I've drawn out key highlights from the report. I'm going to read through you today. Feel free to ask questions along the way. Okay, so as you know, there isn't actually data for this academic year and the previous academic year, so no change to any early years and primary data. There is some secondary data available in the report, however, we're unable to compare that with pre-COVID years, so it's there for you to look at. Schools actually have been using their own internal progress data that can measure pupil outcomes, and our education advisors do visit schools and are able to access that data locally, and it's not able to be public data. For our COVID recovery, we have been supporting with closing the gap and keeping schools open, and also attending incident management team meetings with public health, and that would be in attendance with schools, governors and public health head teachers in order to help keep schools open. During this reporting year, 14 schools have been listed on our schools at risk register, and that is a balance of 7 maintained and 7 academy schools. For Ofsted inspections, we continue to be in line with England and have remained stable across the years, you'll be able to see in the report. We're really finding that our education improvement 4-tier support and challenge model is having a great impact for our maintained schools. Schools that are underperforming have termly challenged task group meetings, and on top of that, they also have education advisor visits between those meetings, and those involve head teachers and chairs of governors where they're scrutinised. Schools also have support plans and impact reports. We now have a strong focus on internal cross-working and collaboration within the council. Termly meetings take place with all services that have contacts with schools to share intelligence and update on schools. This helps the council to ensure that the relevant one council approach is taken with our schools. We also have internal audit taking place across the schools. They're focusing on performance, head teacher performance management, HR issues, pay issues, and also procurement. Now that's also helped with joint working, and it helps our education improvement partnership team to target resources directly to support schools. We're in the 2nd year of supporting with our mental health and wellbeing programme. It's externally funded, and this year we've been able to provide schools with accredited mental health training, first aider training, along with bespoke support with our mental health expert that we have within our team. Our next phase is to embed mental health support teams into more schools across the borough. Child exploitation is a key area that we're working on. We've put into place mandatory training, Future Lives and Your Life You Choose programs with curriculum resources online and search and confiscation support training for schools. We're also building our education portal called LEAP. It's got a lot of information on there that schools are finding very useful, guidance and support and toolkits, also signposting across external resources as well. We've had a huge focus on governor training this academic year and within this report as well, and we've had about 200 or so governors being trained on free briefing sessions that are provided by council officers and also external trainers too that we commission in. This year we've started a new post-16 digital brochure, so that would help post-GCSE phase children to be able to choose options appropriately so they will get all the options available rather than just knowing what their school provides, and this should help with outcomes after post-16. From previous data and soft intel we're receiving, we still feel that the focus for this year and the next few years is our Black Caribbean cohort and White British cohort. So we're ensuring there's a key focus on those areas, and also if they have links with the Youth Justice Service, that we're working closely together to look at underachievement. Now, I'd like to end with what Dan started with about the education partnership model. It's been a huge task moving this forward over the years, and we're really pleased to confirm that this collaboration that we have across the borough with our working party that consists of head teachers, an external independent provider and the council all working together to ensure that we are supporting schools and schools are supporting schools with school-to-school support programme. Most of our primaries are signed up to this partnership model, and the working party is now looking at engaging secondary schools to ensure that the performance that we have, the historical data that we have in secondary schools, they're working on what that partnership model can do together to improve outcomes for our secondary phase across the borough. So that's a very exciting project that we're working on with the Hillingdon Learning Partnership. And with that, I'd like to hand back to Dan.
Thank you, Rani. So the next area we want to sort of highlight is the virtual school and some of the achievements that we've seen over the last few years. So I'm going to hand over now to Catherine, who's our head of the virtual school.
Thanks, Dan, and good evening, committee members. As Dan said, I'm here to talk about the achievements of the virtual school, and particularly our looked after children in Hillingdon. So that starts on page 35 of the report that you've got. I'm also here to touch on some of the achievements of our other vulnerable children in our categories of elective home education, children missing education, exclusions and attendance across the borough. If you have any questions, I can take those. But in terms of the virtual school, we had lots of achievements in the last academic year, which I've been really pleased to already report to the corporate parenting panel. The ones that I wanted to highlight for you from the report are particularly in regards to attainment. So at Key Stage 4, our looked after children achieved an average attainment 8 score of over 28, which, hot off the press yesterday, is 5 grades higher than the average national GCSE grade for looked after children across the country. So I'm really, really pleased with that. In terms of our Key Stage 2 cohort, that 100% of them also made expected levels of progress compared to their progress at Key Stage 1, which is incredible considering all the challenges of the pandemic. We also had another reduction in our NEET figures, which follows a trend of 4 years, which is incredible as well considering the challenges of the pandemic. Our attendance rates were higher than national averages for looked after children, and we also had lots of our level 3 learners at 18 moving on to university study, which was an increase on the previous year. And finally, our fixed term exclusion rate has also continued a 4-year downward trend, and we had the lowest number of days lost to education for exclusions for our looked after children. So really lots to celebrate in that area. In terms of children missing education, you can see from the report that our figures were also down overall, so we managed to close all new open cases in that academic year. Our exclusions were down 7% overall across the borough, which is a huge testament to the work of the Exclusions and Reintegration Officer, who's done lots of incredible work with our schools across the borough to really target some of our issues that we've had in terms of intervention and strategy. And then finally, attendance of all children across the borough was very much in line with national statistics, and we know that lots of our children continue to engage with education very positively throughout last year. Thank you very much, and I can hand over to Tia and Jane to do the SEND update.
Hello, committee members. I'd like to draw your attention to page 39, which outlines the developments within the SEND service and the transformation that we've undergone since 2019. And we'd like to highlight some of the successes, and I'm going to hand over to my colleague Tia, who is responsible for the operational delivery of our successes, and she'll highlight those.
So good evening, committee. So I'm very pleased to announce that we have increased our a cumulative figure of statutory compliance, so our 20-week plans, from 22% in late 2020 to 87%, which is a lot higher than national average, which sat at around 64% of last year. So we are significantly higher, and we hit quite a really good run last year of 100% compliance, especially over the summer, which is an area of real weakness for a lot of local authorities, as we really do need to assess our children in settings for the best outcomes, but we're able to work really collaboratively with our health and care partners to ensure that those assessments were still done in a holistic way and meet our 20-week figures. We also recently hit 99% compliance in our phase transfer for pre-16, which is the highest that Hillingdon has ever recorded. That meant that over 400 of our young people pre-16 had a named setting for September to enable them to have their transition as early as possible. This also then has a roll-on effect with admissions and ensuring that we were adjusting the plans across all of our schools to ensure that there wasn't pressured schools or send magnet schools, which we are seeing to become a little bit of a trend. Last year, we did have 593 EHC needs assessment applications, which is 200 higher than the year before. So we have been doing extensive work with our SAS colleagues, our Specialist Advisory Service, to try and understand what groups of pupils there are and whether this is a COVID response. Our annual review attendance has increased, so all of our officers are now attending all independent annual reviews, all phase transfer annual reviews, and increasing their mainstream attendance annual reviews, so those who may not require any changes but actually do benefit from having the LA present there. We have developed a free training programme for all of our stakeholders, parents and schools, attending coffee mornings, open evenings, to enable parents and carers and young people to speak to us when making an informed decision as to what they're going to put down as a preference. That has been really gratefully received from the Parent Carer Forum, and that was their feedback. We are now having integrated half-termly meetings, so we noticed that health and care or school improvement were meeting with schools on a half-termly or termly basis, but then so were we. So actually, schools would benefit from us having a one council approach, so we have started orchestrating those half-termly meetings together. We have better integrated data sharing for early years, so the one cohort that we didn't have a lot of data on prior to 2021, and especially with COVID, not a lot of uptake in kind of our 2, 3 and 4 year funding. So we are now starting to share that data between admissions and ourselves to understand where our gaps are. And Senko forums have had an exceptionally good uptake this year, so at least 50 Senkos on every Senko forum that we have launched since September. So overall it's been an exceptionally positive year for SEND.
And just to add, we're about to launch our draft SEND strategy for consultation and also our draft SEND sufficiency consultation as well, and also preparing for an impending Ofsted inspection sometime this year and doing work on our self-evaluation framework.
Thank you very much. Does that conclude? Okay, thank you very much indeed for that introduction. That's really helpful. Very thorough and positive report. Lots of positives there. There's lots of questions, I'm sure, but we'll come to those now. So far I've got Mr. Little and Councillor Cooper have indicated, and Councillor Fritz, Councillor Sweetie. So can we start with Mr. Little, please? Thank you.
I wanted to get in early to put in a preliminary question, Chair, which is that this is a very long report and divides up into sections. Could we perhaps break down the questions in some similar sort of way, perhaps taking the questions in part 1, then part 2, then part 3? Because otherwise we'll be dotting around all over the place from person to person, won't we? That was the first one, whatever your decision is. While I've got the mic, can I make a comment, which is to thank officers for the attention they paid to our comments last year and the reformatting of the report. I think it's a distinct improvement, but I've got one little complaint still, and that is the acronyms. Some are explained and some aren't. It would be really nice if someone could read through to make sure they're all got out there in some form. Thank you very much.
Any officer comment on any of that at all?
Comments are always gratefully received, and we take on board the point about acronyms.
I note the suggestion. I'm not quite sure. A number of people have indicated, so it's hard to know what they're going to ask until we hear from them. That's the trouble. Let's see how we go. If there's a need to sort of corral it in a little more strategic way, then we'll think about doing that, if that's okay. But I note the point, and it's one well made.
A real question then.
Go on then. Yeah.
That's in the first section where they're talking about the early years and the Ofsted inspections and the various numbers given in it. And what I wondered was what proportion of our children go to some form of early year setting out of those who are eligible. What sort of, are most of them going, or a minority, or do we even know?
Sorry, can you mind using your microphone, please? Thank you.
We don't have our early years lead with us, and that's not a feature within the report. I'm just wondering, in terms of school-based planning, we wouldn't have that data yet, so we could come back to you with that. I can talk to Sue Hines tomorrow morning, and we can share that with Anisha. Thank you.
Thank you for that. Right, I've now got Councillor Cooper.
Thank you, Chairman. And I'd like to say thank you to officers. There's lots of good news in this report, but even better than that, it's backed up by data, so I'm really happy. Thank you very much indeed. Now, I'm probably going to mix up everyone. I could be confused myself if I tried. I'd like to talk about exclusion data, and I think that's part 3.6. No good asking me for page numbers because I've got a large print agenda. Okay. It looks as if the London Exclusion Networks group is useful and is working well. But our figures for the borough for exclusion still appear to be high, and certainly compared with our neighbours, they're extraordinarily high. And I wonder if there is some explanation other than we hadn't got separate rooms to look after children during COVID. I would really like to understand why those figures are so different for our neighbouring boroughs, and is there anything that we can learn from them? The neighbouring boroughs, that is.
Councillor Cooper?
Thank you, Councillor
Please.
Cooper. I'll take this question as exclusions now falls under my remit. So yes, our figures are considerably higher than the two neighbours that the data compares to, and that is one of the reasons that the Pan London group was engineered by us. So the Exclusions and Reintegration Officer, Dale Hughes, set the group up himself for this specific reason. He wanted to find out why our figures differed so much to our neighbours. I can't give you a specific reason as to why. There is an investigation we're looking into as to our managed move process, because we know that there are different ways of operating the managed move system, and it's something that we're looking to audit potentially in the next academic year to see if that can give us some improvements. I've just completed a funding bid for some additional funding for this area so that we can do some even more targeted intervention in schools and do a deeper dive into exactly what is happening with our schools to find out how we can support them and to bring that figure down even further.
Thank you for that, and I'm pleased that the level of information provided meets with your approval, Councillor Cooper. You've quite rightly provided some challenges to some past reporting, so thank you for that. Okay, I've got Councillor Sweeting next. As you're deferring to your lead, it's up to you. Okay.
Yes, can I thank the officers? It is a much clearer report than we've had in the past. However, I have got some major concerns in various areas. First of all, we're still comparing ourselves nationally. Time and time again, we are saying, yes, we're doing okay nationally. But that's not the standard by which we should be assessed. We should be assessed against our statistical neighbours and our London boroughs. And we're not doing that. Also, part 3 about the standards. I'm looking at statistics from a couple of years ago. So in simple terms, I know a lot of work's been done. I know a lot of effort has been into improving matters, but we are still, as far as 2 years ago anyway, towards the bottom half compared to our statistical neighbours, compared to London boroughs. So, are we improving? Could we not have anecdotal evidence of what's happening in our schools? Can we really say that the 14 schools that are in need of improvement, are they going to be good shortly? Because a lot of those are our secondary schools, and a lot of those are in certain parts of the borough. So the opportunity for parents to have a good school near to where they live in certain areas is just not there. So how are we doing?
Okay.
Thank you,
Please.
Councillor Sweeting. So with the data, we took your comments on board from the last meeting, and our data team have put in statistical neighbour data and London data to compare Hillingdon with where possible. So where you see in the report that there isn't statistical neighbours or London data, it means it's not publicly available. Now they've tried to access this data, they've checked with other London boroughs, and they've assured us that everything within this report is what is available. And in terms of the 14 at-risk schools that are on our schools at-risk register, we do have soft intelligence and local data that we go into schools through our education advisors and analyse and work with the schools, but it's not publicly available data. So through the challenge task group meetings and the education advisor visits, the support 4-tier model I mentioned earlier, through using that model, education advisors through the Education Improvement Partnership team are assured, and they have assured that all the schools are doing what they need to be doing in terms of improving performance. Where underperformance is taking place, then the council will decide on whether a warning notice needs to be issued if they do not see rapid improvement according to the meetings that take place. So the 4-tier model is what we use when data isn't available, and even with the data that's available, to go into schools to locally improve those schools. And if improvements are not made, then we use our local powers of intervention.
Quick follow-up then, Councillor Sweeting.
Well, it's an important follow-up actually. We have not got in this report latest Ofsted reports, and there's one very, very concerning one, is there not, about a special school. So Hillingdon had a role to play in monitoring that particular special school, as they do with all of our schools. So what's happened that the Ofsted report from Christmas has been so very devastating?
Thank you. Connie?
Thank you, Councillor Sweeting. As this report indicates, we can only report on 2020 to 21. Therefore, any information provided by Ofsted after the 31st of August 2021 isn't contained within this report. However, we do have the access to that information, and we have been working closely with the school, and we are able to provide information separately to this report.
Very much. I'm going to come in with a question before I bring in Councillor Prince, and it's just really around the question of the partnership arrangement that we brought in. I think that's probably the biggest single achievement for my money, if you like, in terms of what's being presented here. And I think of things like mental health. There's a lot of good stuff in here about how we're building capacity with mental health support in schools. And I remember when Councillor Prince was first elected, and I was Cabinet Member for Health, we talk about developing preventative services and keeping people out of clinical support and all the rest of it. One of the challenges always, though, was the fact that, with the best will in the world, 90% of our secondary schools are academies, and of course their own legal entities in their own right. And how do we get buy-in? This was a real frustration. I'm just wondering what's in this new partnership arrangement that can give us a bit more confidence about that moving forward, if you would, please.
Thank you, Chair. So with the new partnership arrangement, we believe this version of the partnership model, which we've been trying to get off the ground for a number of years, is the fact that we work very closely with our Regional Schools Commissioner. During COVID, they have made it very clear to academy schools that they must work closely with the local authorities, so that has helped. The pandemic has helped in that way. This partnership model was built using an independent provider, so that gave the academies a voice, so they knew that this partnership model is not just local authority driven, it is borough-wide, and it was undertaken by an external independent reviewer, which was paid for by the working partner, including schools, the local authority as well. So it's truly a new way of working through collaboration and through an independent partnership model with equal voices across the board.
And in terms of secondary engagement, the working party has brought in engagement from the primaries, and they're now talking to the secondary, the HASH, which is Hillingdon Association of Secondary Head Teachers, in order to make sure that what they're able to deliver is designed within the model. So that phase of working in terms of secondary buy-in to the partnership model is being designed with the secondary head teachers. And as you say, the majority of them are academy head teachers. So we are hoping that when that model is designed, secondary schools will be part of that model and will be able to work across phase, across borough.
And just to add, sorry, Chairman, just to add, I'm echoing very much what Rani just said. There is a real commitment from the schools that I've spoken to want to improve educational outcomes for children in the borough, and this is a collaborative approach to achieve that, which means then that schools can share their expertise and resources where that's required, and unlock opportunities which otherwise, if schools worked independently of one another, would not be necessarily available. So it allows us to achieve a lot more by working collaboratively, and from what I've heard from working with schools, they're pleased to be taking this step forward.
Thank you for that. Councillor Prince next.
Thank you, Chair. You'll be pleased to know that other members asked most of my questions, so I only have one left, and it's about, on the executive summary, part 1. I was enthused to read the part where it says, the Council continues to raise standards in education, because that is what all of us want. But then I carried on, and it says 14 schools were listed on the Council's Schools at Risk Register. Schools admissions had a decrease in primary applications despite the many primary school places that we have, and there's been an increase in elected home education applications, that's parents choosing not to send their children to school and choosing to educate them at home. Is that raising standards?
Okay, is that you, Dan?
Yeah, I can take that one. I mean, there are always going to be challenges with every local authority area, and a number of the challenges we have seen over the last couple of years are connected directly with the pandemic, and that includes rising numbers of parents and carers who choose to educate their children at home, and that was directly related in a number of cases to concern about the transmission of infection. And so therefore, you know, it has been a challenge to raise standards in the way that we had originally hoped, and as all local authority education leaders had hoped during the period of the pandemic. But nevertheless, school leaders did their very best, working in very difficult circumstances. So, and I think what's important, I suppose, with this report is to recognise where there are real strengths and where there are always going to be areas for further improvement. And that collaborative partnership that we spoke about just a moment ago is that platform, that new era to help us recover from the pandemic and actually set the pace going forward.
Thank you, Dan. Councillor McQuarrie.
Thank you, Chairman. It's really encouraging to see that there are wellbeing initiatives being implemented in schools. How exactly are we monitoring and measuring the success of these initiatives?
You've taken that one then. Ronnie.
I'm happy to take that. Thank you, Councillor. With a mental health initiative started in 2020, and from our baseline data, it was a national programme that was funded for all local authorities. We trained all of our schools in 2020. Then we had some feedback forms from schools to see what they needed next in order to build on what they had learnt in 2020. From that, and we had a second year of funding, we were able to use it in order to give the schools what they wanted, which was mental health first aid training. Another area, we had lots of variable data coming from schools with mental health, and we realised it was very custom and very local. Therefore, we then used some of the funding to recruit a mental health lead expert. She is providing individual customised support to all schools, including academies, across the borough for one academic year. They get 1 day of support. They have an initial meeting to talk about the needs within their own school. If they work within an academy group, then we would utilise that multi-academy trust. And from that, they're able to use their mental health funding that way. And then by the end of this academic year, we are going to analyse that data and see what we can do to build on in year 3 for schools.
Okay. Ms. Sisley, you've got a follow-up.
not so much a follow-up to my own question, but a follow-up to Councillor Cooper's. I wanted to return to the area of exclusions. On page 37, where it's talking about the looked after children excluded, it mentions that 65% of those with fixed terms exclusions also had special education need. And I wondered whether that was the case more broadly, that is, that the children with special educational needs were disproportionately excluded, and if so, were moves being made to improve liaison with the schools and training for the schools to help them overcome the difficulties they have in managing these kind of pupils? And the second part is also relating to exclusions, that in a couple of the paragraphs it draws attention to an increase in weapons being brought into schools. How serious a problem is that in this area, and is it something that we can take steps against?
So in answer to the first part of your question regarding the children with SEN who've been excluded, which was predominantly for social, emotional health, mental health reasons, it's not disproportionately just for children with SEN. If you actually look at all exclusions data, the vast majority of exclusions take place for children who have needs in that area, or it's related to mental health. So I wouldn't say that that's a disproportionate thing for all looked after children, if that answers the first part of your question.
Not quite. Well, what it suggests is that children who have special needs, and particularly those in that particular aspect of special needs, are disproportionately excluded for one reason or another, suggests that there is a problem in managing those children as far as the teachers are concerned, and therefore that additional resources needed to help them overcome that, because these kids deserve an education as much as anybody else does.
Absolutely, yeah, they do. And I think it can be quite a difficult area to address the need of, because it's a softer target to aim for than perhaps a more physical disability that a child with SEN might have. I don't know if colleagues from SEN wanted to come in at this point to comment on our SEMH provision in the borough.
So we haven't seen the numbers of children with SEMH, so social, emotional, mental health, coming through our panel that we would have expected by the COVID response. So we did anticipate that children being at home for prolonged periods of time were going to come to our panels, or potentially get excluded because they're so used to the routines of home that actually going back into a school setting and having to adhere to those boundaries and those routines was actually going to be exceptionally difficult for them. What was positive to see was that actually wasn't the picture that we got. The children had staggered starts back into schools, so from an EHCP point of view, we hadn't seen a lot of children that had an EHCP with SEMH as their primary designated need being excluded as we anticipated. So from a SEM point of view, it was a positive picture. What we have been asking schools to do is look at their behaviour management plans and their strategies locally within their schools or in their academy trusts. So where you have got children who are disengaging, withdrawn, or showing low attendance rates, or when they are in school, escalating their behaviours to that, don't adhere to your behaviour policy, looking at their reasonable adjustments and remaining that inclusive nature of they may need a movement break, it may be something very small that they may need, but we have to understand that they have special educational needs, and what fits one will not fit the child next door to them. So we have had a lot of engagement from schools. They have called us rather than excluding and saying, we have this problem, can you help? So the Willows, which is our primary SCMH setting, has been doing a lot more outreach than they have ever done before. And then obviously we have YPA, which is our secondary provision, which has been helping schools should they pick up the phone.
Okay, thank you very much indeed. Now I've got one further question from Councillor Sweeting. Okay, if you just quickly do that, we'll come to Councillor Sweeting.
So
okay.
In regards to offensive weapons, you asked if it is a problem in the borough, and to be honest, if there's even a single offensive weapon that a child brings into a school, yes, I would consider it a problem. And clearly from the data that you can see, there have been incidences of permanent exclusions which have been related to offensive weapons. One of the things that we've done as part of our exclusions and reintegration programme is that we've piloted an offensive weapons protocol. That's been already 12 months in the making and is due to be launched in the summer term. So we're piloting it with 12 partner agencies who are going to be trained. Our schools and local authority officers will be trained in how to search children safely and make sure that we are addressing that need within a school so that we can try to avoid permanent exclusions. And we're also setting up a task and finish group to work on the protocol together to try and avoid any permanent exclusions for offensive weapons. So it is very much high on our agenda, as it is for our colleagues in the Youth Justice Service, who will also be launching work in terms of their knife archers that can be launched in schools.
Okay, Councillor Switzy.
Thank you, Chair. Page 29 provides information on the Fair Access Panel. Why are there so many southern children referred to the Fair Access Panel? And is this linked in any way to the number of children, Year 6 children, not getting any of their 6 preferences into Year 7?
I mean, our sort of understanding of the in-year fair access process, and just to explain to the committee, the in-year fair access process is used typically for in-year applications, not exclusively, where you know, the local school is full, and there's a need to ensure a fair allocation of children to school places, so they don't all end up in one school. So and that process is supported by the local authority and chaired by head teachers. To our understanding, it's not to do with, you know, a particular acute shortage of places or a particular issue. It can be to sometimes be from year to year, ebbs and flows, changes, and we've certainly seen a lot of changes in the last couple of years connected with the pandemic. I don't know, Sarah, is there anything that you wanted to add from a sort of particularly from a school places planning perspective on that particular question?
Well, I mean, I think we're talking about Year 6, so it's not about them having not got into the school of their choice, because that's a Year 7 issue. I think it's about the fact that many of our primary schools are full in year groups, and so there'll be parents not able to get into the primary school that they want to in Year 6. Is that?
No, I was talking about the transference from Year 6 to 7, not getting into the secondary school, because, you know, there is the 91% of the children, it says in the report, are children living in the southern areas. So there's obviously something about those areas where the Fair Access Panel is required to deliver the place, because some of these children are out of school, 43, were out of school for more than 2 months.
Okay. Are we in a position to respond to that question here, Dan, and any of your colleagues?
We can look into that and come back through.
Okay, fine. Okay, fair enough. Thank you. Okay, I think I've got one further question from Councillor McQuarrie.
Thank you, Chairman. Just looking at Key Stage 1 outcomes in Hillingdon, it says that it needs to provide a different approach to stretch and challenge more able pupils. Can anyone explain how this will be delivered? Thank you.
Thank you, Councillor. So that would be delivered through the partnership model. The partnership model will have successful head teachers with models in place where they have worked with high ability children, and through using the internal data we talked about earlier, they will be able to work with other schools to provide that support. So it's a school to school led model that we'll be using through the Hillingdon Learning Partnership.
I've just got a final question, just for clarity, if I may. What I'm reading in the report on page 20 around performance outcomes is what seems to be a clear statement that there's been a decrease in the number of schools at risk of underperformance. Can I just, have I understood that correctly? There has actually been a decrease? Okay.
Yes, Chair.
Okay, I just want to be clear. Okay. To come to some kind of conclusion here, there's more than the recommendation to note the report, and there's plenty of good things to note. No doubt there are plenty of challenges as well. It was ever thus. We're also required to consider some reports to go to Cabinet when this comes before Cabinet, and what I've done and what I've circulated in advance were some draft comments that we might want to consider. Now, whether these find favour or not will remains to be seen. I don't intend to write this by committee. I don't think it works. I think if these aren't broadly acceptable, then I think my inclination would be to see if we can deal with it offline. But let me read them first for the benefit of the watching public. So what I'm proposing is the committee commends the comprehensive and well-presented report and work of the Officer team during the course of this unprecedented and extraordinarily challenging period in raising the standard and quality of education in Hillingdon. The committee particularly welcomes the establishment of a partnership model with schools and the opportunity it brings to drive improvements across the sector. Improvements in attainment of looked after children, the reduction of schools at risk of underperformance, the development of mental health support capacity in schools are welcome. The committee notes the approach to ongoing challenges in areas such as exclusions, attendance, NEETs, which I should say is people who are not in education, employment or training, to explain the acronym. So attendance, so that's NEETs, and looks forward to future reporting with updates in these and other areas within the scope of the report. That's what I'm floating for the purposes of discussion there. That's acceptable to members on my side. Can I invite Councillor Prince to comment on that?
Preferably, can we discuss this out the meeting? There's some bits that I want to suggest rephrasing. Okay. Well, I suppose I've got two choices here. I could either put this to the vote, or I could say, let's delegate it to myself to finalise in consultation with the Labour leader. I'd rather do the latter, because I'd rather we spoke with one voice if we possibly can. So if members are in agreement with that, that's what I'll suggest we do. Okay. And other than that, that we note the report and look forward to further information in these areas. Thank you very much indeed. Is that agreed? Yes. Thank you very much. Right. So we now come to agenda item 7, which is the quarterly school place planning update, which we're going to hear from Sarah Phillips, and I'll say over to you, please, Sarah.
Thank you, Chair, members. First of all, I want to apologise that this is a slightly smaller report than I'd hoped, because I had hoped that we would be able to present to you the full January rolls by school, like we did in the October report the previous report of the October rolls, which you had. Unfortunately, we haven't yet got the January census fully calculated. There's been some delays with the DFE and some of the academy schools, so that's why there's a thinness to this. The main focus is on the secondary places, the secondary transfer, and how we manage that and what we've learnt from it, including the pattern of movement of pupils. But the big thing, of course, is that all resident pupils, including 105 with the HCPs, were all offered a place. Obviously, there were a lot of pupils who live in other boroughs but very close to our schools who were also offered a place, and lots of our residents who were offered a place in other boroughs. Then, in terms of primary, we've still got quite a lot of movement going on, and that's the same across London. Some of it's inwards, some of it's around the borough, and some of it is still outwards. As far as I can ascertain from the anecdotes of the schools I've spoken to over the last months and weeks, the school rolls haven't changed that much since the October rolls, but sometimes the number of pupils the actual pupils have changed. They've got the same numbers, but they've had different children coming in and out of each class, which of course is then disruptive, particularly, and affecting COVID catch-up and all the things we've been talking about. It's important as well to note that whereas most of the secondary schools are very full, and some have got more than 1 year of bulge classes, that there are a few small secondary schools and a few 4 schools that do have some vacancies. And although we've got more schools in the primary sector who've got some places. The places tend to be within each class. So instead of having classes of 30, they're down to 25, or in some cases less. We've only got very few primary schools now that have got that we've not tackled and helped them with a reduction in PAN, where they've got more than 30 spaces empty in a year group, and more than about half of the primary schools are completely full. We are looking though at what we can do to help those primary schools which are getting smaller. We've got very few one-form entry schools, but we do have a few, and we've got some other schools that are getting closer to being just below two-form entry now, and we're looking at their financial and educational viability. We want to ensure, as we've said, that all schools are successful, sustainable and viable, and we've got a bigger strategy to do that, particularly with primary schools, which links to their partnership working, but also to a more to really encouraging some governors and some sharing of facilities between schools, especially between infant and junior schools. And then finally, the report covers the ways in which we're adding extra places to meet the rising demand for EHCPs. This committee's had reports over the last few years about how we've been using the SEND grant that we've had so far, and we've added several hundred places where we could, but we still needed to add a lot more places, and we've done this big review, and you're aware that we've got now a dedicated schools grant deficit valve, safety valve agreement with the DFE, which links to giving us some more revenue and capital to adjust SEN policies, but also to add more places in the borough. So the report really shows you how, in particular, the outcome of the secondary transfer, what that revealed, and it does reveal quite a lot about the movements around the borough. And I'll take questions if there are any.
No, thank you very much, Sarah. So let's see who we've got. We've got Councillor McQuarna. Okay, bear with me a moment. Okay, Councillor McQuarna first, please.
Thank you, Chair. In previous meetings, we've been hearing about the unprecedented numbers of in-year applications. Where are we with that now?
At the moment, we haven't had that. We've had and remember last year it happened after August, and some of those were parents who were already in a school deciding to try and change school. So at the moment we haven't got that. We had for secondary, we had what we thought, which was the highest number of applications ever for secondary, or in recent years certainly, and they were all placed once we added 150 extra temporary places. We had 120 pupils left who had applied after the October deadline, so they were placed last week in addition. And now what's happening is that some parents are accepting or declining those offers, and there's some movement going on. And so the unprecedented number of in-year applications really took off from August last year. So we're hoping that maybe it won't quite be like that. I think it's true to say that it was from August to around October last year, and then slowed down. But there have been in-year moves throughout the year. And I think one of the things that particularly all the schools find slightly upsetting is that when there are vacancies in a popular school, some parents will choose to move in year and fill that, and then that starts a little bit more of a merry-go-round, and that's on a bigger level than it used to be, of movement by choice in year.
Okay. Right, I'm going to call Councillor Prince next.
Thank you. On the safety valve process and the bid to the DfE, I just want to be 100% sure I understand what this is saying. So the DfE have given us, was it 21 million? So when you say 22 million, is that we've bid for another one? Or is, I'm just trying to understand what the number means, sorry.
We've bid for more capital. Where was the figure exactly that you're talking of?
Sorry, at page 78, where it's got in the heading for extra capital grant, I assume that means circa 22 million and a new free school.
Oh yeah, it was the bid was about 22 million. I think it was slightly more in the end because we realised there'd been some inflation, and we haven't had a result of that yet. And a free school, yes. So
sorry, is the 22 on top of what we've already received?
Yes.
Had the safety valve, so it will be.
No, in the safety valve, we've only received revenue. We haven't had capital yet.
Right, okay,
so this is the capital element of the safety valve, really.
Great, thank you.
Right, who have we got next? I've got Mr. Little next. Thank you.
Thank you, Chair. My questions, plural, also relate to the safety valve scheme and the other comments in the report on page 76. In terms of the table on page 78, reading it, it suggests there are considerable uncertainties over and above the financing element that would be involved. I mean, you've got to find somebody who's willing to give you your new free school. Some of the other comments seem to be quite conditional. So my question on that aspect would be, what degree of certainty do we have that if we had the money that the programme would be able to be completed? My second question relates to the comment on page 76 where it says that the purpose of the recovery programme is to reduce the in-year deficit in this year as far as possible. What means are we taking to do that? And I suppose the corollary of that is what revenue are we getting that's extra? And my third question relates to paragraph 13 there, where it says that the officers in the Education Directorate have been aligned with the progression of the programme. In what way aligned?
Okay, I'll deal with the beginning and the first and the third, and then hand over to Tia for the middle one on revenue. So the uncertainties were partly when I wrote this, and I've written things like Primary Academy, because we have got them all agreed and lined up. It's just that some of them haven't had their full governing body meeting yet to go through the plans with them. There's a lot more detailed plans have been developed and are being developed as we speak. So I'm pretty confident that all of those can be delivered. The issues that are a stress is definitely about the cost rises in construction and getting contractors to deliver works. In an ordinary time, you'd think we've got plans now, we've got schools who are willing to host these things, we've had feasibility studies that show it'll work, we've got other models around the borough or in other parts of London that we know that we're going to copy, so there isn't that level of uncertainty. The uncertainty is really with the risks that are linked now to construction delivery. Then the free school, we've got several potential places that we could maybe put a free school. We've said that we think it might be as many as 180. We've put it as 180 places. We're still looking to refine to be absolutely sure do we need it that big. And we know that there are a free school has to be delivered by an academy trust, and that means it's a process that is partly involving the DfE. We know there are some academy trusts in the borough who would be interested in
bidding for it. So I don't think that will be a problem either. So on that I'm quite happy. What was your third one that I thought I could answer? Sorry.
One about the alignment.
Oh, the alignment is partly because there are some new staff posts being created, and the opportunity's being taken in really to make sure that they're aligned to making sure that all of these things can be delivered. And then the middle bit about the non-place element, if you like, about the other things being done to restructure SEN, I'll hand over to Jane and Tia.
Just before we sort of just jump in, just on the align point, I think, and just to give the committee confidence and colleagues are involved, is that there is a dedicated programme board to deliver the programme that Sarah's just described, and that as part of the sort of alignment, there are additional resources from within the council that have been brought in to programme manage and to support the delivery of that programme and keep it on track. And there is a regular lots of project team meetings which colleagues are heavily involved in, and there is a regular programme board to keep track of and govern the progress of this programme, and that's an important point in addition to the extra resources that Sarah's touched on as well. But I thought that's an important point just to add in, and I'll.
Please carry on.
And just to add, in terms of the school place development, we're also working on the strand of early intervention as well. So we're actually thinking of investing in early intervention. We've got the specialist advisory support service that is working prior to statutory assessment, offering support around SEN support level as well. So that's an additional strand along with the school place planning as well, the focus on early intervention and trying as far as possible to redirect and manage down the number of referrals for EHCPs.
So the big question around how we're going to reduce the in-year deficit over the next few years with increasing numbers coming to our panels is we've looked at the repatriation of independent placements. So we've noticed that in previous years a lot of our pupils have been sent out of borough to specialist or independent settings, or potentially even mainstream schools with an EHCP. And what we have done is looked quite intrinsically into the annual review process to ascertain could we bring them back. And that's not due to massively a financial reason as the first and foremost, but the quality of their education and their community links. If we've got children that are attending a school 45 minutes away, they're not actually going to gain any community links when they go into post-16 education or into employment, is what we're hoping for. We're also looking at the EHCP needs requests that we are getting in. So could it have been that an early support or early intervention strategy could have been put in place prior to them needing something? And if we are saying no to assess because they don't meet the statutory two-part test, actually, instead of saying no with a letter, which parents, don't want to receive in their email inbox, we're giving them a next step and a way forward, and actually saying, your child's needs don't appear to be long-term, we don't have the evidence of that, however, we do have a service, this person is going to call you, and we're going to work out why they're supporting your school or why you have no faith in that support. During our half-termly meetings with schools, we're not just focusing on our children with EHCPs, so the SEN officer role has evolved somewhat so that we can work alongside our SAS colleagues and our educational psychology colleagues to understand what the SEN support levels are. So we're looking very, very closely at the census data, how many more children are being put on SEN support, why, and then we're targeting those schools and targeting those pupils to see if we can put in supported at the earliest possible point. All of that will then drive down our deficit figure in year, and obviously will give us the proposed plan of the DSG safety valve that we have given to the DFE.
Thank you very much indeed for those answers. Councillor Sweeting.
Thank you very much, Chair. I'd like to concentrate on the secondary school places issue. And I'm finding table 2 the most informative of all the tables actually in this report. It took me a while to get my brain around it, but there are some figures which I will sort of highlight before I ask my question, if I may. Looking at the schools in the north of the A40, there are 431 children who live in the south going north. And then there's this cross-borough movement with 295 children who live out borough coming into our schools, but this is then balanced with 236 Hillingdon pupils going out borough. And then we have, looking at the schools to the south, 283 of our children living in the south going out borough. So in essence, it seems to me that what we've got is a great shift of southern children going north. Then there's this to and fro in the very north of the borough, going out borough and then coming in, and that's because there are good schools on the out borough as well as good schools there. But we've also got these huge numbers, 283, going from the southern schools, southern areas, to out borough, and they are predominantly going to Slough, and it's predominantly going to grammar schools. So my question is, if there is the pressure in the north, and that's why we're putting the school in the north, why? Because the pressure actually are the southern children coming to north. It's not that the fact that there's not the capacity in the north, it's that that capacity is taken up with children coming from the south to the north. So my analysis of the whole situation is, if there was a good quality, outstanding school in the south, because there isn't one, which is a faith school, that will then draw down the children from the south now going north to predominantly faith schools back into the south. There wouldn't then be the pressure in the north. The in-borough, out-borough flow in the north is more or less balanced. That's not really the big issue. The big issue are southern parents choosing a school in the north. And so by putting another school in the north, yes, you have got that pocket of pressure as a certain area in the north, but you wouldn't have it if, I think, you were providing additional secondary places in the south. And if they were of good standard, then you wouldn't have this scatter approach that the southern parents are having to go to. We had a map a few
Councillor
times
Prince,
ago.
sorry,
We had a few times ago
make your point,
which
please.
had that scatter. So I'm asking, why are we actually not addressing the issue of the southern problem rather than the north problem?
Before you answer that, just a thought on that. And I should declare an interest in the old boy at the school, but I wonder to what extent Derry Martyrs, being in the north of the borough, as a Roman Catholic secondary school in the north, skews our figures to an extent. So perhaps you can weave that into your response as well, if you wouldn't mind. Thank you.
Thank you, both of you. And yes, Douay Martyrs is the big outlier. It's more than 80% of the roll of that school, so they're nearly all going to Douay Martyrs. I think the other thing about Douay Martyrs is it is in the north of the borough, but it's at the end of the only footbridge that goes over the A40, so it's the easiest school as well for people to get to, that they can get off a bus in the south and walk into the school in 10 minutes. So it's quite a particular situation, so perhaps we need to look at that. We haven't really ever thought about starting the process of, when we've talked to the DfE about the free school bid, which had been made for the north many years ago when the demand figures were much higher, we were looking for sites, and people have been looking for sites before I came, and during my time the DfE started looking, and we said, well, if you can find a site in the south, so be it, you know, because we were finding it hard. A secondary school that's for sixth form entry with sixth form and with a large SEN unit takes up a lot of space, and the search couldn't find a site in the south either. But the point is, I take your point, you're quite right, there's a drift going up to the south, and then there's a lot of movement on the eastern border, as I'd say, as you'd call it. And of course that's because that's where there's an awful lot of housing. So there's a lot of people who live in other boroughs who live very close to Hillingdon schools, who, you know, as the map shows, are very close to that eastern border. There's not many people who live even within 4 miles or 5 miles, unfortunately, of Harefield, where we do have quite a lot of spaces. And we also know that we've got some other new schools that have been built around the borders. I'm not sure that adding a new school to the south is would work. It's certainly not a short-term solution, not one that we've got the money or the willingness from the DFE to engage with, but it's the answer that we give is really in the earlier report, which is that by working with some of the schools in the south to improve, we can already see in the high figures the fact that there's more than sixth form entry of parents wanting to go to them, that they are becoming more successful and more desirable. I take your point that there is an issue, that Hillingdon isn't selective. It's also linked to some of the other issues in the earlier report, that of those people going out of the borough, many of them are going to selective or semi-selective schools in Slough, Buckinghamshire, Hertfordshire, and that does mean that some of our schools have a more unbanded population that they're dealing with, which does lead to some of the challenges that we've heard of. But we can't really add another school into the mix without creating unintended other consequences. The geography of the schools and the geography of the borough doesn't entirely add up perfectly. I think that's one problem, and that parents choosing faith schools do tend to be the ones travelling the furthest.
Dan, you wanted to add to that?
And just to add to those those important points that Sarah's raised, in addition to obviously to the parental preference around faith schools and obviously selective schools outside the borough, when in terms of the presentation it's presented as south of the A40, but in reality when you do start to break down the numbers, the parental preference is largely concentrated around the centre of the borough, going north above the A40. So in other words, Uxbridge, North Uxbridge, that area, you do see the greatest movement of pupils' parental preference into those schools which are north. And when we say north, it can be just across the A40 into, for example, Viners. So I think it's actually about, from our perspective in terms of school place planning, we get into a lot of granular detail which is summarised here. And so therefore it can sometimes oversimplify the presentation, but we know that the vast majority of that movement are largely families, in terms of the move from south to north, of families living in the sort of centre of the borough, moving to schools, sometimes just in very short distance from home.
Thank you very much. Go on, quick supplementary then.
Oh, my concern as well is the very small print which in the notes of the table above, which says that there were 233 pupils that were left with no match to their preferences. Now, I think that's an increase in previous years. So, I should think the majority of those are in fact southern parents, are they not?
No, I don't think. Well, it's about half and half. It's whether it's disproportionate. We can look at that again. It is more than in previous years, as I've said. It's only, I think, 1% more in total of the total, because the total was larger than previous years. I think last year I'm recalling it was something like 196. So but I might be wrong. And they are made an offer to their closest school, and that's the kind of advice that we follow. Of course, the problem with that is it may be that they've chosen not to apply to their local school.
Or indeed used all of their preferences, because sometimes we do receive applications from parents and carers that don't list the full 6 preferences for schools.
So there will be some movement with parents declining offers, then being offered another one, being told which schools have still got places, and moving around. And it'll be more than just those 200. But it's probably a relatively small proportion of the total number going into year 7, but since the total is larger than normal, and also because of it being cross-borough. So with these kind of numbers, with several hundred coming in, several hundred going out, so as soon as a place comes up in one of your higher preferences for for the next few months, people will be asked, well, would you like to take it? If they take it, it then starts the domino effect all over again.
Indeed. Sorry, do you...
I was going to say the other thing, of course, is that pupils in the south have the benefit of more chance of getting into the girls-only school, because that's located in the south, and that's another issue, like with the faith schools, which then distorts the preferences sometimes for other people. I mean, there's no doubt that some people in certain areas of the borough will have a greater chance, like a girl in the south will have more chance of getting into various schools than if you're a boy, for example, because of that.
Thank you, Sarah. I mean, we could talk about this for a long, long time, couldn't we? I mean, how many times have we said in the past that this is an extremely challenging area of service? We have particular pressures in the borough that are unique to Hillingdon, and obviously Heathrow is a significant factor in all that. It's worth just pointing out that we are, in spite of all that, we are the most successful borough in West London in terms of making offers to parents of preference. Certainly a great many first preferences. So I think we should celebrate and recognise that, notwithstanding some of the challenges that Councillor Sweeting has highlighted. And I don't think it's really for us to second guess those professional judgments. Whilst it's our job to ask challenging questions, undoubtedly. Okay, I'm looking around the room. No, there are no further indications. So with that, I'll wrap up. As I say, very positive report. Can I clarify one thing? We are to receive some further information which isn't available yet. Is that right, Sarah?
Well, at the next committee, the thing that isn't available yet is the
January rolls.
The January rolls.
Okay.
And perhaps looking at that issue of the proportion who were left with no place between north and south. But the trouble is, it's not necessarily their north and southness of residence that was the issue. It may have been their choice of schools.
Okay, but that information is to follow. Just to be clear. Okay, thank you very much. Okay, so let's wrap this up. Thank you very much again, Sarah, for your presentation. Some extremely good work is going on. It's been very encouraging to see what's happening in relation to the safety valve, which clearly is bringing some challenges and will moving forward. I mean, this is only the beginning, really, isn't it? It was really encouraging to see the report to Cabinet last week about Meadow School, which is very much part of that. So I think I'll wind up, but can I just say in concluding, thank you to Sarah, because this is the last meeting at which we will see her, because she is retiring at Easter after 3.5 years. So you won't have the pleasure of coming to present here and answer our questions. It's been a joy having you work with us, and you've really contributed magnificently. So you go with our heartfelt thanks and our very best wishes. Thank you very much. I'm sure my colleagues all around the room would acknowledge that. With that, is the recommendation agreed? Thank you very much. Thank you. Thank you, Sarah.
Thank you. I've enjoyed it, and I'm helping shape the future, and I'm being replaced by 2 people. And as part of the new alignment, they're not entirely in post yet, but they will be. Indeed. And I'm leaving lists for everyone as to what they've got to do.
Indeed. Sarah, thank you very much indeed. Great, thank you. Okay, right. So with that we will move on. So we've got agenda item 8 next, Cabinet Forward Plan. I'll move the recommendation. The only thing I will say that I can't quite see on here is the major review assistive living technology that's being presented to April Cabinet, I believe. Can't see it here, but I'll just make that point, so I'll be doing that. Other than that, any comments or questions? No? There appears to be none. Thank you very much. Is recommendation agreed? Thank you. And then finally, agenda item 9, Select Committee Work Programme. We have another meeting on the 20th of April, and we'll see what we get. We've made the point about the youth service and what information we can have. Let's see where we come to with that. Any other comments? Councillor Prince, you look poised as if you're about to say something, but perhaps you're not. Okay. Can we agree with the recommendation then? Thank you very much indeed. Okay, so in drawing the meeting to a conclusion, can I thank our watching public for observing our deliberations over the last, couple of hours or so, and thank the officers for their support for our discussions and the members for their attendance and participation. I think we've had some good, challenging discussions and debate, which is what it's all about. So thank you very much indeed.